Hi, I'm Dr. Pooja Agarwal, breast surgeon at Manipal Hospital Saltlake. Lactational abscess. It means very painful breast during the lactation period. So it can happen anytime between few weeks after the pregnancy or delivery, and it can happen even after 1.5 months after delivery. So this is a very painful condition of the breast, usually seen in young mothers and in women who become mothers for the first time. So in this, the main symptom is pain and redness of the breast. The breast becomes swollen, it becomes red, and there is intense pain. Fever can be there. There might be nausea, vomiting, and the female might have difficulty in feeding the child. So we all feel scared. Now what will happen? How will we feed the child? So the main cause of it is the bacteria from the child's mouth goes from the child's mouth and the oral cavity into the breast of the mother through the cracks or the openings of the nipples, and that causes the infection. And this is very painful for the patient. So the patient comes to us with redness or swelling of the breast and difficulty in feeding the child. So we promote, please go on feeding the child, because the most common cause is because the child is not getting adequately fed by the mother. There is improper feeding, breastfeeding. The child is missing the feeds normal duration of the feed. So there is collection of milk in the breast, which is a very good medium for organisms to grow. So this causes infection. So how do we treat it? We promote breastfeeding, obviously. We teach them the right technique of breastfeeding. Pain management is very important because, as I said, this is a very painful condition. And because it is a bacterial infection, we treat it by antibiotic. Usually with proper care and with good antibiotic, it subsides. But yes, it takes a little bit of time, and reassurance, very important, because there's a constant fear what will happen. A woman is having a lot of pain, the feeding of the child becomes difficult, and again that also causes more collection of the milk. So it's a cycle which continues. So it is very important. Please don't be scared. If you feel this, please come and visit the doctor. Most of the time it can be managed with some medicines. I understand it's discomforting, but it can be managed. So if you feel something before going on to home remedies and doing all sorts of things at home, visit a doctor, because it can be very easily managed with medicines. Thank you.